Welcome to the Mama Village. In this podcast, mothers will share positive and unfiltered stories about pregnancy, birth, postpartum, and motherhood. I will also bring you interviews with experts such as lactation consultants, midwives, physios, doulas, and more. I want to help you feel informed so that you can make choices that support you and your family, because it takes a village to support a mother. I'm your host, Ellen. Hi everyone, and welcome back to another episode of the Mama Village. Today we have a truly inspiring guest joining us, Sunni, a dedicated naturopath, nutritionist and mum of two. Sunni specialises in working with women through fertility, preconception, pregnancy and postpartum, and she brings a wealth of knowledge to our conversation today. In this episode, we dive deep into the world of nutrition during pregnancy and postpartum, and Sunni shares her insights on Ayurvedic and herbal remedies that can support both physical and mental well-being during this transformative time. We explore essential minerals that can alleviate common pregnancy-related symptoms and discuss the crucial role of mental health in overall pregnancy care. One of the highlights of our conversation is Sunni's perspective on the often overlooked aspects of women's health in the medical system, including the need for a more personalised approach and an emphasis on mental health. We also delve into the fascinating topic of the gut microbiome and its impact on both physical health and emotional balance. So whether you're expecting a new mum or simply interested in holistic approaches to health, this episode is packed with valuable information and practical tips to support you on your journey. Now don't forget that if you like the show, please subscribe and leave a review on your podcast platform. Now let's get into today's episode. Hi Sunni, and welcome to the Mama Village.
Thanks, Ellen. Thank you so much for having me.
I'm super excited to have you on here today. So do you want to start by telling the listeners a bit about yourself? So who you are, who's in your family, and where you're from?
Yeah, absolutely. So my name's Sunny. I've been a naturopath for 15 years in private practice. My family consists of two little ones. So I've got a 4.5-year-old daughter who's starting prep next year. So we're in that transition. And I also have a 13-month-old little boy. So I had Javira at the beginning of COVID, so 2020. So that seems like decades ago. So much has happened in that time.
Oh, what a beautiful little family.
Yeah.
Do you want to tell us a little bit about your professional background? Because we're going to get into that today. So what inspired you to become a nutritionist and a naturopath? And tell us how you got there today.
Yep. So I've been a naturopath for about 15 years, as I said. And it's funny, Ellen, I kind of always knew I was going to be a naturopath. I remember when I was about 13 or 14 years old, my parents are quite spiritual. The law of attraction, the law of attraction, that whole secret thing.
Yeah.
They actually had a burnt disc of that and they left it at home for me and my two siblings, and said, kids, watch this. And then they went overseas for a week. So we didn't see them for a few days after that. So after watching that, I actually made a vision board. And on that vision board, there's all this natural health stuff and, also personal goals and all of that sort of thing. But the biggest goal on that vision board, which I still have, was to become a natural healthcare practitioner. So interestingly, it's just something that I think I was always meant to be. It's a science, but I think for me, it's also my craft. It is something I practice every day in my daily life. And I'm just lucky enough that I was able to make a career out of it.
Oh, that's amazing. I love that.
I got really interested in the mental health aspect of naturopathy and natural medicine. So that led me down lots of different scientific roads as well. So I've got a master's in human nutrition with a focus on behavioral neuroscience and social psychology. So the mental health approach from a natural perspective is really what I do a lot of. I've done lots of product development. I'm a university lecturer as well, so I currently lecture 10 hours a week at Torrens University in Brisbane, and that's in mainly clinical, so assisting final year students in treating clients in a practical setting. And I currently practice in a women's only space, so Ritual House in Brisbane. We're a fairly new business, but our main focus is nurture and community for women.
Oh, I love that. It sounds beautiful.
It is also probably something that I was manifested, because it is the most beautiful workspace with the most beautiful women. Got psychology, kinesiology. Founder has a profound journey as well through motherhood. She's got 6 kids, and this was just again a passion of hers that, has just come to life really beautifully.
Love, love, love that. So, do you want to start by explaining how naturopathy is and how it differs from conventional medicine, particularly in the context of maternal health?
Yeah, absolutely. So the key principles in naturopathy, of course, is firstly not to do any harm. So harm is obviously things as extreme as birth trauma, but even small things like side effects from taking a Nurofen or taking 10 Nurofen a day for pain, whatever it might be. So harm, there is a scale of harm, whether it's quite severe or whether it's a minor side effect from a medication. So the first principle in naturopathy is to no harm is caused whatsoever. The second is education. So doctor is teacher. So in naturopathic medicine, one of the key things I do is educate clients on we do this because of this, not just take this medicine and go home. There's a really vast difference between take these herbs because they're going to focus on your gastrointestinal health in order to absorb your nutrients better, to assist your focus or baby brain or whatever it might be for that particular month. So those sort of principles are where we differ. But where we are aligned with allopathic medicine is obviously the patient comes first. So patient care is always first and foremost for all healthcare practitioners, well, at least it should be. Unfortunately, there is a lot of politics and other things that come into play when you're in a bigger public healthcare system rather than a private clinical practice.
Yeah, financial and all sorts. Yeah.
Absolutely, financial, even in private hospitals, they are run like corporates, right? It's not really a healthcare setting, it's a corporate setting. So that makes a really big difference in decisions that are made. Even simple things like whether a mum has iron deficiency, whether the hospital wants to pay for the infusion or not. So a simple thing like that can mean so much of a difference for that mum. It becomes more of a business choice rather than a what's best for the client choice.
Totally.
We also look a lot at the whole person. So particularly and this varies depending on what kind of condition we're looking at or what kind of client I have. But when it comes to mums, treating the whole person from a naturopathic perspective is the mum and the baby. When you are pregnant, and in my personal view, as a mum, even that first year postpartum in that perinatal period, the mum and the baby are still one entity. For me, I'm quite a spiritual person that you share one. Your emotions are regulated the same, your spirits are aligned, the whole thing is still one. So treating the whole person is actually treating the mum alongside the baby. Unfortunately, what does happen in allopathic care is everything becomes very infant centric and the mum's health unfortunately becomes the second line of treatment, the second priority. So I think when we look at treating the whole, the mum and the baby is one. It's that one whole. So those are the ways that similar and also very, very different.
Yeah, I love that. You mentioned that mum sort of comes second, but I also feel like in the system, mum's mental health is completely disregarded. We're so interested in the physical body and the physical baby, but mental health is completely disregarded. So, like you were saying with the iron infusion, just as an example, I mean, who cares if mum's feeling super tired? Like it comes down to a financial reasoning as to whether we give this infusion or not, or time pressures or resource availability. So all these other factors, and mum's mental health is pushed down to the very bottom.
Absolutely, absolutely. And that maternal and postnatal period in mental health for women is probably one of the most overlooked areas of medicine, definitely 100%. The physical postnatal period, there's plenty of, even if you look at research articles and that sort of thing in this space, the amount of clinical trials that are conducted on women's postnatal anxiety and depression, okay, postnatal psychosis, postnatal bipolar disorder, and the worsening of symptoms in manic episodes in that postnatal period, the evidence is just not there, Ellen. It is absolutely completely overlooked from a research perspective.
Yeah. Oh, such a big topic.
Get in there, aren't we,
So,
Ellen? We didn't muck around this morning.
yeah. I love it. All it takes is a passionate person, and then here we are.
Yep.
So bringing it back, how does naturopathy principles guide your approach to preconception care and fertility?
So for myself, it's always phases. So preconception care can begin, as early as a year or even your first thought of, I'm thinking about having a baby. Preconception care begins when you want it to begin. From a scientific perspective, I personally like to allow 6 months. However, 3 months is still sufficient because the eggs the oocytes that we're sort of developing right now won't be released for another 3 months. In men, the sperm that is going to be released in 3 months is maturing now. So we want to give that sperm and the egg the best chance and the best quality for 3 months' time. Preconception care in naturopathic medicine is very holistic. So it includes obviously stress management, exercise, weight management, beginning to feel all of those nutrient needs, which we'll cover, probably do a bit of a list later on of all of the nutrients in that preconception period, but also looking at ovulation factors and signs and symptoms, and making sure that mum can understand what all of that means as well. So this is where that doctor is teacher thing comes in. And I think actually lately, women have become really amazing in this self-awareness sort of space with their cycles and learning a little bit about what ovulation signs are and what their mucus should look like. Whereas 10 years ago or so, I couldn't get a woman to tell me what her mucus looked like. It was just wasn't it wasn't something that was paid attention to.
I also think an element of that too is we're so conditioned from a really young age to put all the trust in the medical system and telling us when we can have a baby. We lose that inner trust and inner knowing with what our own bodies are doing and sort of tuning in with that and trusting our instincts. So I think we're coming to a point now where women are starting to learn more about their bodies and education and resources are more readily available, particularly on social media, about how to tune in with our bodies. And I absolutely love that. So it's really great to hear that even you're seeing that too in your practice, that women are starting to pay attention to these changes in their bodies again, so that they become familiar with their own cycles.
Yeah,
Yeah.
absolutely. And even things like contraceptives, throughout the years, we've always sort of been told, come off the pill or come off insulin, you'll get pregnant, it'll be fine. There's no issues with, and then women will be on the pill for 20 years and come off and want to be pregnant next month. So it's just not that simple. So I think we're in a really great space for women's reproductive health at the moment.
Yes, I
And
love that.
there is, there is a lot of positives to social media. People do have more information. In the health world, we're always saying, oh, social media and Dr. Google and all of that sort of stuff. But there's always a silver lining. I think women have become really self-aware because of social media as well.
Yeah, and it even just brings about this awareness that there's other options
Mm.
outside of a westernized medical system. Like there's natural approaches to things. I mean, before social media, where would we go for that information? We relied on wise women in our lives to pass that information on throughout, generations. And for me in particular, I grew up surrounded by nurses and doctors all through my family. So all that wise woman knowledge was gone. you
Yeah.
know
Yeah.
yeah, so social media has been a powerful tool in, I guess, raising awareness that there's other options out there and more natural
Absolutely.
approaches. Yeah.
Yeah, definitely. It's a very powerful tool, I think. Yeah.
So, in what ways can naturopathy help support a healthy pregnancy, and what are some common practices that you recommend?
Yep. So with healthy pregnancy through naturopathy, the first thing we want to do is make sure the cycle is regular. We know when the mum is ovulating, so this is all preconception. Once pregnancy has been established and there's a fertilized egg that's attached, HCG levels are coming up in the blood work, that's where we also need to look at the mum's maternal history as well. Has there been a history of miscarriages? For me, as a holistic practitioner, I also then start to delve into a history of mental health with that client as well. Has there been anything there in the past? Has there been incidences in the past? Have you taken medications in the past? Have you used recreational drugs in the past? Do you have a history of addiction? Even things like smoking, cigarettes. Mothers that have smoked cigarettes, in current evidence, have shown they fall pregnant, and the stress and anxiety around pregnancy. Some moms actually pick up smoking in pregnancy if they've had a history of
Wow.
smoking. It's insane, isn't it? So to deal with that stress level, knowing all of the other side effects, etc., but not wanting to go on medication, and vaping as well, which is, as we know, a huge issue at the moment in Australia. Some mums, if they've had that history of using substances in the past, they will have a tougher time either staying away from the substances or not going back to the substance or finding other substances.
Mm.
So maternal mental health has to be addressed from the beginning. And this whole thing of postpartum mental health, what about pregnancy mental health? Who talks
Yes.
about pregnancy mental health? Who talks about mums sitting at home in their little whatever nesting phase, thinking, what am I going to do if I can't sleep? What am I going to do about this? What am I going to do about that? Do I need an outlet sock to hear my baby's breathing all night? Is that something I need to buy? Where am I going to find the $500 to buy that? That self talk that mums have during pregnancy, and you're never sleeping in pregnancy either, especially towards the end. So you've got 24 hours to be thinking all these thoughts.
Yeah,
It's
yeah.
just not a good scene that's being set for a lot of mums.
Mm.
So pregnancy mental health is something we need to think about as well.
Yes, I love that.
Yeah, and there are a lot of beautiful, safe herbs that you can take in lower doses during pregnancy that can really help with anxiety, especially first time mums. Being a first time mum 5 years ago was tough enough. Being a first time mum now would be even tougher, I think, with the
Oh, yeah.
expectations. And it's a very challenging time to parent rather than have a newborn baby. So I think it's really essential to support mums, whether that be through herbs or nutrients or supplements or whatever that mum responds to from a mental health perspective, whether that be breath work or journaling or whatever it might be.
Oh, I love that you have this massive mental health component. And that's why I was throwing my hands up earlier because, like, finally we're talking about mental health. And I love that you're talking about the importance of it during pregnancy because we do often look to postpartum. I mean, even postpartum is
Mm,
disregarded a lot. And I won't get into that right now.
yeah,
But I love that you're bringing it back to the starting point, to pregnancy, and even implementing these practices throughout your pregnancy, whether that's supplementing with herbs, like you said, or
yeah,
journaling or whatever it might be, will play out into the postpartum period as well. It affects both. And your mothering. Yes, I love that. So, what are some of the key naturopathy remedies or practices that help manage common pregnancy symptoms like you were talking about? But we'll talk about the physical symptoms first. So morning sickness, fatigue, those kinds of symptoms.
absolutely. So I think when we're looking at that whole sort of preconception, pregnancy, postpartum and breastfeeding is kind of all in one. There's like a foundational line of nutrients and herbs that can kind of set the groundwork for all of those other hormones to function correctly. Because ultimately, every single pregnancy sign or symptom that you have is going to be hormonally driven, even the mental health stuff. So even depression, etc., the reason it happens once you've just given birth or postpartum is because of that drop in your estrogen, progesterone, etc. So everything is hormonally driven for us as mothers. So that's where the groundwork for good hormonal health begins. So from a holistic perspective, we need our guts and our livers to work really, really well from the get-go. We can't eliminate toxins and neurotoxins and excess estrogen from the beginning. It's going to be very, very challenging to cope with that up and down of pregnancy and postpartum. Some of the physical signs and symptoms, say for example, morning sickness, we all hear about things like ginger lollies and ginger tea and all of that sort of thing, which is beautiful and very, very effective. Ginger is one of the oldest and probably most golden herbs or food, whichever category you want to put little ginger in, used for warming the body, warming the system from an energetic perspective, but also cutting the knees out of nausea as well. Vitamin B6 is another essential one. And vitamin B6, it's generally normally in most natal supplements. So we'll talk about some natal supplements probably a bit later. But that amount of B6, you can actually add an extra dose on top because the B6 actually has an effect on the parts of your brain that control emesis, so vomiting. So from a neuroscientific perspective, the vitamin B6 actually says, hey, no, we don't need to vomit right now. Take it down a notch. And that way it kind of helps. Won't completely eliminate the nausea. The evidence isn't that strong yet. However, it's based on that theory that it will sort of talk to your brain and cut the knees out of that whole process. When we're looking at remedies, for fatigue, etc., you do need to work on nutrient deficiencies first, and then you can bring in herbs. And herbs you do have to be very careful with in pregnancy. A lot of herbs aren't safe for use. A lot of herbs haven't been trialed for use. So in Ayurvedic medicine, a lot of different herbs were used for fatigue and nourishing the body and uterine tonics, etc., for preparation for birth. But if you look at the current evidence now, it would just be a hard no, don't use. But it's not really a unsafe herb. It just hasn't been explored yet as safe. So when you're exploring herbal medicine in pregnancy, you really do need to be under a qualified herbalist rather than using supplements online and that sort of thing. It's essential.
Great advice. And just with the nausea that you mentioned before, you mentioned a vitamin B deficiency. Does magnesium also play a role in nausea?
Absolutely. Magnesium is one of the key nutrients that helps our gastrointestinal function, but also our mental health and nervous system. And magnesium is very, very safe through pregnancy. It's also excellent for pregnancy constipation. So, particularly magnesium citrates, I think every pregnant mum has dealt with pregnancy constipation at some point, and even postpartum constipation. So, magnesium citrate in high doses is excellent for that. Magnesium is also great for pregnancy insomnia, pregnancy anxiety. So, it's a very, very effective mineral to utilize through pregnancy.
Oh, nice. And just to bring it back a little bit too, so when you would meet with a client or a mother and you would be going through all of these sorts of vitamins and minerals, would you order blood work to sort of get the baseline of where her nutritional levels are at before you give any specific advice?
Absolutely, yeah. Generally, if a mum is already pregnant, she'll have the initial blood work through the GP or the OB, but if not, then yeah, we'll always order that through.
Yeah. So, how can naturopathy assist with management of diagnoses in pregnancy, such as gestational diabetes or high blood pressure, those sorts of diagnoses?
Yeah, absolutely. So, metabolic presentation, so gestational diabetes and elevated blood pressure, preeclampsia, those sort of conditions, there's lots of different ways in which we can manage them. However, the key goal from a naturopathic perspective is to prevent them from happening. So, from the get go, we don't want mum to be, for example, how much weight should mums be gaining in pregnancy? Not every single mum that walks in needs to gain 15 to 18 kilos through pregnancy, right? If I have a mum that comes in that's in overweight, obese category, I actually don't want you to gain any weight at all. No weight should be gained at all through to 38 weeks of pregnancy. It's a big call. But you have to speak to your mums in the way that if we want to keep your blood glucose regulated, if you want to keep your blood pressure in a healthy range, we need to avoid excess weight gain. So this goes back to BMI. So taking mum's BMI at the beginning and ensuring that from a nutritional perspective, her diet is controlled in a manner that, the whole thing, Ellen, of, you're eating for two and go for it. And mums can go get a little bit carried away with that. So it is essential to educate mum that, you do need to keep weight in check in order to prevent gestational diabetes, preeclampsia from occurring. If they were to occur, then certainly we need to then start working on first and foremost diet. So sugar and salt, sugar, salt and oil, the three best things for food, but the worst things for our health, particularly in those pregnancy months. However, if the mum is really struggling and GP or obstetrician is wanting to put mum on medication, we can come up with different interventions like taurine and herbal amino acids, etc., that can help blood pressure. A lot of herbs like cinnamon, inositol, etc., that we use normally for type 2 diabetes are not safe in pregnancy. So again, yeah, you really need to, it's really individualized actually, Ellen. It's hard to say what remedy you give across the board.
I'm glad you said that because I think it takes a woman coming in to see you and be giving specific individualized advice rather than generalist information, because each woman is different. And just me as an example, I don't like to weigh myself on the scales, but I do know just in my first pregnancy, as an example, I did see a private obstetrician before I got into this new way of viewing birth and pregnancy. And throughout my private obstetric appointments, I would get weighed in every appointment, and I ended up putting 20 kilos on throughout that pregnancy, but I was very fit. And so whilst on paper they say you shouldn't put on, I think, more than 15 kilos in pregnancy or something like that, it's a very generalist sort of guide. my obstetrician looked at me and said, "You are very fit. You are very healthy. I know you've put on 20
Yeah.
kilos in pregnancy, but this is just your body. This is how
Yes.
your body grows a baby." And so I think it's so important to get individualized care and recommendations rather than take on generalist advice. But this is obviously very good general knowledge for
Yeah.
you anyway, and information for
Yeah.
an educational perspective.
Definitely. And you're absolutely right, Ellen. Every mum will sort of be told, 15 to 18 kilos is what we want you to gain. But for yourself, being a healthy, active, healthy weight, that is an appropriate amount to gain, up to 20 kilos, even 25 kilos. If you're underweight, actually, recommendation is up to 27 kilos. But if you're in the overweight category, it's like, we just want you to gain the weight of the baby and the placenta, that's it. Whereas in the obese category, it's like, no, we actually want to start using some of your current weight to build a baby as such.
Yeah. And that's to, like you said, prevent things like preeclampsia and high blood pressure and gestational diabetes, any of those sort of diagnoses that could affect your birth and postpartum experience. And even
Absolutely.
pregnancy experience, yeah. So we talked a little bit about nutritional supplements. So coming back to that, what role do nutritional supplements play in naturopathy care for pregnant and postpartum women? And can you recommend any specific supplements?
Yeah, absolutely. So again, there's a foundation when it comes to nutrition. So some of the key things that I think are essential through preconception and pregnancy is definitely omega-3s. Most Australians are omega-3 deficient. The other key nutrients that are essential, selenium, zinc, magnesium, obviously our activated folate, not folic acid, but an activator folate is also very important for the mood, mental health, but obviously the spina bifida prevention. Most good quality natural vitamins now contain a little bit of folic acid and activated folate. And I think that's actually a really good way to dose folate, particularly for the first 3 months. Cover all of your bases because actually those first 3 months is when the spinal cord is forming. Once you're kind of out of that first trimester, you're out of the woods with spina bifida issues. So those are obviously the essentials. The other thing that I think is so essential for mum's well-being is their iron levels. And I think iron for every single mum, this is not individualized, Ellen. I think this is a blanket approach for everyone I see should take iron from like the day you find out you're pregnant. The amount of blood and hemoglobin that it takes to grow that placenta, it's huge. It's so much. The body's needs are so great. And most of us as women living in the modern world, we're all under or borderline. So it's very important.
Yeah. And it's important to, again, coming back to naturopathy, is if you speak to a naturopath, they will look at your blood baseline levels and be able to tell straight away if there are deficiencies in certain nutrients and minerals like iron, where the same levels being looked at by a GP might see that and think, oh, you're on the borderline, but you're fine. I'm not going to recommend you anything. But if you actually speak to someone in holistic care, they might say, look, I don't think this is actually good enough for you. And I think you do need to
Yeah,
supplement
absolutely.
iron.
Yeah. The range of iron is so broad. So the range is say the range is 20 to 200, right? If you're sitting at 22, you're in range and good. But a woman's 22 reading of iron is so depleting. Ferritin, for example, the range is, 30 to 250. Whereas some women in the postpartum, not postpartum even through pregnancy, their ferritin levels can be 3 or 4 or 7. And the exhaustion that comes with that, alongside your body, like literally taking everything from you for the placenta and the baby, the amniotic fluid, it's very, very challenging. Very challenging.
Mm. Oh, I'm so glad that you mentioned that. And so you spoke a little bit about specific advice for herbal remedies, but generally from an educational perspective, are there any particular herbs that are effective for supporting maternal health during pregnancy and postpartum?
Absolutely. So, maternal health, there are some beautiful herbs that you can use in lower doses. I'm sure you've heard of raspberry leaf tea being talked about as a really nice uterine tonic. It can also be used, it's very safe and effective, obviously.
Yeah, can you talk a little bit about that? Because I don't think
Yeah.
I've spoken to someone before about what raspberry leaf tea does.
Yeah, so the main understanding is raspberry leaf tea brings on labour. However, it is a very powerful and nurturing and nourishing uterine tonic that can be used throughout the course of pregnancy and postpartum as well. So raspberry leaf tea really helps to keep the uterine tone nice and strong. So there is actually evidence for raspberry leaf both in traditional medicine. So with herbal medicine, we've got traditional evidence and then we have like scientific clinical trials. So traditional evidence with raspberry leaf tea for miscarriage prevention as well in the earlier trimesters. So it really is something that can be used throughout the pregnancy. There are other herbs to be used in pregnancy and postpartum that help with the baby. So there are, and I'll talk about some Ayurvedic, more food as medicine remedies as well. But ginger liquid you can actually use as a herbal tonic as well for the nausea side of things, but also for digestion, reflux. So many women suffer with really bad reflux and heartburn through pregnancy. So ginger is really good for increasing digestion and therefore reducing some of those signs and symptoms as well.
So you mentioned a couple of herbal remedies that you would recommend, like ginger, raspberry leaf tea, and those sorts of things. Are there any other supplements that you would recommend, like probiotics in pregnancy and postpartum for women?
Absolutely. So there's quite a few different probiotic strains that mum can take throughout the course of the pregnancy that still has an effect on the infant after birth, which I think is really interesting and quite amazing because the previous knowledge that we had on the gut microbiome is if you were to have a cesarean, the baby wouldn't get any of those good bacteria from the vaginal canal and they're born in a sterile sort of environment. So newer evidence is starting to show us that when mums take particular probiotics, it can actually prevent things like eczema, asthma, and sinus infections, etc., if the baby has a history of that in the family as well. So some really great strains for maternal care include Rhamnosus strains, so LGG and HN001. And some of these you can find in particular mother baby probiotics. So in that sort of sense, there's a huge space for this. And we're actually seeing now, I was reading the other morning, there's a clinical trial running at the moment on the maternal microbiome and how that can prevent anxiety in the postpartum period.
Wow.
Yeah, gut health and gut flora has a huge role in mental health as well.
Can you explain a little bit more about the importance of having a healthy gut microbiome and how mothers can improve their gut microbiome, whether this is in the preconception phase or in pregnancy, postpartum? Because I imagine there are foods that we can consume to improve it, and there's toxins in the home and those sorts of things. I'll let you talk to all of that. But yeah, I'd love for you to speak to that.
Yeah, absolutely. When it comes to gut microbiome, unfortunately, we think we need this big whiz bang probiotic to get a great gut microbiome. But the simplest and most effective advice for good, healthy gut flora is a solid, varied diet and lots of colors, lots and lots of different fruits and vegetables, eating things that you wouldn't normally eat. So when I'm discussing gut flora with a mum or anyone actually, I'll often say try and eat a new fruit or a vegetable every week. Just go to the fruit veggie shop, find something random and weird that maybe you don't even know the name of, and eat it. Eat it. That's my advice for good gut flora. And it is also essential. It's not just about probiotics, it really is about prebiotics as well. So, what nutrients and fibers, soluble fibers we need to feed the bacteria as well. So, if that bacteria doesn't have food, it will just die off, and there's no point taking the $50 probiotics that we've prescribed you. So, first and foremost, 100% diet. But then you also do, like you mentioned, household toxins, cleaners, overuse of antibiotics, overuse of medications, using a lot of plastics in the house or, plastic water bottles, things like that, all affect our gut micro. Mold, Queensland, we have obviously a huge mold issue. So that's another. Alcohol, exercise actually affects your gut microbiome. So if you aren't doing any exercise, you won't have as diverse of a gut microbiome. Having a pet in the house. So some clinical trials were done with infants that had a cat or a dog and infants that didn't. And the infants that had a cat or a dog had much more diverse microflora than the ones that.
Wow, that's so interesting.
Yeah, a pet in the home is one of the best things you can do for your kid's immune system.
Wow.
Yeah.
That's great.
Yeah.
And I've heard things about improving your gut microbiome. You could also consume things like, I think it's pronounced kefir. Is that right?
Yeah, absolutely.
Yeah, and sauerkraut, those sorts of things, those
Yeah.
sort of fermented foods to improve your gut microbiome as well. And you mentioned a mental health component too. So, by improving our gut microbiome, how does that affect us in a physical and mental sphere?
So, one of the key neurotransmitters that makes us happy and keeps us feeling good is serotonin. Now, 90% of our serotonin is actually made in the gut. It's not made in the brain. It's made in our digestive system. And it
Wow.
crosses the blood-brain barrier, gets to our brain, and makes us feel good. So, interestingly, if you have a good, healthy gut flora or are eating particular, some people you eat a meal and you're just like, you know what, I feel good after that. That is generally because, the foods agree with you, there's no intolerances or issues, but your serotonin production has been fed pretty much. Things that feed that include tryptophan-rich foods, so things like turkey, nuts and seeds, etc. There's a really, really strong link between the gut and the brain. So a good example of this, Alan, is when, say, someone's got anxiety and they get diarrhea. So that is basically your brain sending messages to your gut saying, we are not happy. And it goes vice versa as well. If your gut's not happy, you can get mind fog after eating some particular foods. You can feel really lethargic after eating fatty meals. That's your gut saying that was not good for us.
Yeah. Ah, so fascinating.
Yeah.
And by improving your gut microbiome in the preconception phase and in pregnancy as well, does that pass through to the baby? Do you have any knowledge about that?
Yeah. So prior knowledge told us that no, it didn't. Our mum's bacteria didn't translocate to the baby. But as research advances, we've got all these new tools. So now we're seeing, so the baby's first poo, I'm sure as mums, we all know what that looks like, that black tar meconium.
Yeah.
We now have particular testing methods to test that first meconium poo for bacteria. Now, we've actually saw that probiotic strains that mum took as a supplement were present in that black tar meconium after the baby was born. And this was not vaginal born babies, this was cesarean born babies. So bacteria doesn't just translocate in a vaginal birth, it's translocating by the placenta as well when the baby is still inside mum.
Wow. And if a woman, you mentioned earlier that, when you have a vaginal birth, your gut microbiome passes to the baby through the vaginal canal. But for a cesarean, where that process hasn't occurred, by improving your own gut microbiome and breastfeeding your baby, does that help improve your baby's gut microbiome health?
Absolutely. And their immunity as well. So there's so many things we can do now. Because cesareans are becoming more and more popular, both elective, emergency, sort of end phase, whatever it might be. But cesareans, we're doing more Caesars now in the private and public system than ever before.
Yeah.
So it is really essential for mums to know that there is so much they can do. If they were to have a cesarean and that wasn't part of their birth plan, or they have an elective cesarean and that also wasn't there by choice, that there is things they can do. There's no shame or guilt in having a Caesar. You're not going to ruin your kid's immunity for the rest of their lives by having a Caesar. There's plenty of things that you can do.
No, and I'm so glad you said that. There's no shame in that whatsoever. In saying that, the cesarean rates, like you said, are going through the roof at the moment. They're higher than they ever have been, and that is absolutely not the recommendation. They're being performed more often than what they should be, which is not a good thing.
Yeah,
But there is absolutely no shame in having a cesarean. I cannot stress that enough. It is
absolutely.
absolutely, yeah, no shame. But like you said, there's so many happening at the moment. It's super important to talk about how we can improve things like gut microbiome because the education is just, the educational aspect is just so important.
Absolutely. And I think as well, on a personal note, I think there's no shame in electing to have a Caesar. I've had two elected Caesars. Both my babies were born by cesarean by choice. That was due to various different reasons that we won't get into now. But, as a mum, I really was like, because I'm so, holistic and a naturopath and all this sort of thing, it was a very tough pill to swallow. And I think naturally as women, I still ruminate on that, even though I have all of the knowledge and I did all of the gut microbiome things. It's just, I think it's how we're built, isn't it?
Yeah, for sure. So, what's your experience with Ayurvedic care?
With Ayurvedic care, when it comes to maternal support, there is a lot of it that happens through the pregnancy, but there is specific things that happen in that fourth trimester. In Ayurvedic medicine, it's called the Suara period, and it's 42 days. In that period for women, obviously it's a complete time of rest, which doesn't always happen now in the modern world. But those 42 days are meant to be purely for rest. Some of the key principles of Ayurvedic care include obviously keeping the body really warm in that time. So hot showers, belly binding, castor oil packs post-pregnancy to eliminate any stagnant blood, lots of different warming foods, very low amounts of like cold foods or raw vegetables, etc. So everything should be cooked, slow cooked, steamed, etc. No housework. Breastfeeding is obviously encouraged. I know, no cooking actually. So in true
Oh, I'm
Ayurvedic,
laughing because it doesn't happen in reality, but it's great. This is what should happen. This is what
this
should
is
happen. But yes,
absolutely what should
yeah.
happen. No cooking. No cooking, no cleaning, none of that. And have you heard about the 5-5-5 method? So 5 days
Yes.
in bed, 5 days on bed, 5 days around bed. So that, but like times 3 or 4 is pretty much what Ayurvedic postpartum care is. One of the most common, and I would be here forever if I went through every single little Ayurvedic remedy, but one of the most common ones is dill water. So, and that's for the mother to consume post birth to start eliminating. If there's actually a big detoxification component post birth in Ayurvedic medicine as well, to get rid of excess fluid from the mother's body, excess blood from the mother's body, and excess uterine tissue as well. So one of the most common ones is dill water, and that actually helps increase breast milk production and also helps with baby's gas as well. So through the breast milk, the baby will get lots of dill through there as well. So a really nice one.
Oh, beautiful. So, are there any sort of particular tips or rituals that you could recommend to mothers to, I guess, incorporate in their daily routine?
Absolutely. I think a really common one, whether you've had a Caesar birth or a natural birth, is belly binding. And now this is not for any sort of cosmetic at all. It really is to get your uterus back from a watermelon down to a tiny little peach. We really need to encourage the uterus to come back to size. We're not forcing it, but it is very, very important to encourage that to happen as quickly as we can. Another really important thing, I think, from an emotional perspective is baby massage. So Ayurvedic baby massage, generally done with an oil of some sort. You can use a baby oil, but sesame oil is a really popular one in Ayurvedic medicine. Is a really great way for mum to bond with the baby. It's wonderful to relax the baby, help with digestive function for the baby, and also to really assist formation of the baby's muscles. Like you see things about like flat head syndrome and all of that. So Ayurvedic baby massage, and there's lots of wonderful tutorials and that sort of thing online that you can look at. Is a really, really good way to start that relationship with your baby as well.
Oh, how beautiful. And you mentioned a lot about the physical aspects, like bringing uterus back down to its usual size and even muscular with the baby. But what are some of the benefits to Ayurvedic practices for enhancing connection between mother and baby and getting that overall sense of balance postpartum?
Yeah, yeah. Funny you ask. I actually had a student the other day that was talking to me about the baby blues and what that sort of looked like. So, baby blues is generally that first 3 days to a week after giving birth, where the mum can sometimes feel quite disconnected from the baby, or depending on what the birth has been like, can feel quite out of sorts or out of their body. It is, of course, it's an out of body experience. But some ways to connect with the baby, skin to skin, as we all know, is one of the key ways to. And skin to skin is also excellent for gut microbiome of the baby. Both mum and dad's bacteria is translocated to the baby from by skin as well. And also making sure that there is good feeding methods in place. Breastfeeding if you can, but obviously that again is not something that every mum can do. And another one, Ellen, where there's just no shame. If breastfeeding doesn't happen to you, for you, it doesn't happen,
Yeah,
right? And
yeah, totally.
it just has to be that way. There are other ways to bond with your baby rather than just feeding as well. I think from a spiritual perspective in Ayurvedic medicine, eye contact is really essential with the babies because really they really are all you know and all they have through their lives of, those first few months and in utero as well. You're their everything. You're absolutely their everything. So just knowing that you're there and seeing you is enough. for the baby to bond with you.
Oh, I'm so glad you spoke about eye contact because I had to receive some sort of educational seminar on this about how important eye contact is with your baby and building their connection because they can't really do much else. And
Yeah, yeah,
it's amazing, like when they want to make eye contact with you, try and hold that for as long as you can. And they will take little breaks themselves. They'll do a blink or they'll just do a little subtle look away or whatever it might be. And then when they're finished, like they're too tired for it, they'll give all those cues to you. It's just such a beautiful way to bond with your baby. So I'm so glad that you brought that up.
it really is. Even whether you're breastfeeding or bottom feeding, or however you're feeding, even just the baby touching your face, that it really is a way that they're trying to tell you that, oh, that's who you are. That in itself is bonding. We don't need these big, extravagant practices in place. Just looking and touching your baby is bonding with your baby.
Yes. So, we've talked a lot about your background in naturopathy and we've briefly touched on nutrition, but you have this background in nutrition as well. So, I'd love to talk a bit more about that. So, can you speak to what role nutrition plays in preconception and fertility and share some key dietary recommendations for women who are planning to conceive?
Yeah, absolutely. So from a clinical nutrition approach, obviously, the protein, carbs, fat, hydration, those sort of basics are very important. However, there are also quite a lot of nutritionals that can be used therapeutically. First, to fall pregnant, to maintain a pregnancy, so to get a pregnancy all the way through to full term is another big one. And then also nutrients that are used postpartum for postpartum care as well. So, from a food perspective, there's a lot of different food as medicine things that we use. Obviously, I've talked about a couple warming foods, all of that sort of thing, but making sure that from a nutrition perspective, omega 3s is really the biggest, can't stress it enough, deficiency that women have. Magnesium and zinc, we covered a little bit earlier on. We in Australia live in such a stressed out environment in the modern world. Our body chews through zinc, magnesium, and B group vitamins, particularly B12, especially for women that are vegetarian or vegan. They have no B12. Another really common deficiency that mums can have, and babies actually have, and newborns can need supplementation for, is vitamin D. So, vitamin D, we live in a slip, slop, slap culture, and most of us can't actually absorb enough vitamin D from the sun anyway. The demand on our body for vitamin D are greater than they have ever been. So vitamin D, either in supplementation or fortified foods, using things like eggs, mushrooms, etc., is essential. Eggs is actually probably one of my favorite preconception, pregnancy, postpartum, any stage of life food because of the levels of choline that eggs contain. And choline is very important for the baby's development, but also for mum to feel healthy and supported mentally through the pregnancy.
Wow, so interesting.
Mm.
So, what are some specific nutrients or foods? You mentioned eggs, but that are particularly important for women during the preconception period and then pregnancy as well. So, you mentioned omega 3s. Where could you find omega 3s as an example?
So obviously, fish is not always the greatest choice for women because of the mercury content that fish does contain. You need to keep a watch on how much you're actually consuming. But things like linseeds, chia seeds, seed products are great. And supplementation. If you were to take a fish oil through that time, there's absolutely nothing wrong with that. It can be really, really challenging to, especially if you've got morning sickness or hypermesis, very challenging to be able to get all of those foods into the diet. So a vegan omega from an algae source or a fish oil sort of supplement is a great way to go. Also really good if you're at risk of preeclampsia or diabetes.
Yeah. And in terms of other foods, I mean, we talked a little bit about it in the gut microbiome aspect as well, but trying different fruits and vegetables and having sort of a good balance of the different colors of fruits and vegetables in your diet. And anything else that you can sort of add to that? Any other foods that would be good in the preconception and pregnancy phase?
Definitely. So fats. So making sure that you're having lots of good quality fat. As women, we have up to 35% body fat, opposed to men who have 20 to 25. We need body fat in order to have enough estrogen to a fall pregnant and to have a full term pregnancy, and it even has an impact on your birth, the way the birth occurs, all of that sort, and recovery. So good sources of fat include like clarified butter. So in Ayurvedic medicine, we use a lot of ghee. We use a lot of sesame oil, lots of avocados, nuts and seeds, etc. The importance of fat, particularly for women, in maternal care is, yeah, a really big area. And as women, we're kind of programmed to avoid fats, but that again, I think is a good space of this is a time to reframe what good fats look like and our understanding and attitude and awareness around healthy fat.
Yeah, I'm trying to drill it into my own family as well in terms of my mum and so on, how it's been drilled into them that fats are bad and good fats are bad, like avocados and sesame oil and all those sorts of things are
Mm,
just bad. And so
yeah.
unlearning all of this is just such a process for me, as I imagine it is for so many others.
Absolutely.
Yeah.
There's so much unlearning to do as we learn more and more about how the body works and adopting, going back to, as you mentioned, the wise women philosophies and what those women would have recommended for us to do as their daughters and sisters, etc., when we fell pregnant and had babies, was to, nurture yourself. And they would even do baby massage with things like clarified butter. So just cover the baby in butter for dry skin conditions, obviously, but also for their nourishment. So they would actually have this external nourishing quality as well.
Oh, that's so nice. So, how does nutrition impact postpartum recovery? You have spoken about it a little bit, but what are some of the key dietary strategies that you can support just the healing and energy levels of a mum when she's just given birth?
So after birth, I think the biggest thing nutritionally is whether mum's breastfeeding or not. So if mum is breastfeeding, we actually need more energy to breastfeed than to be pregnant. So during breastfeeding, you need up to 700 or 800 extra calories a day. For any phase of pregnancy, the highest, well, first and second trimester, you don't actually need any extra calories in the day. The last trimester, yes, you do need a little bit more, but it's about 200 calories, which is a snack. So mums need to eat a lot more food if they are breastfeeding than not. So I think my biggest message for postpartum nutrition is not to try to go into the whole weight loss straight after you've had the baby thing, and to ensure that you consume enough nutrients to produce enough breast milk. I think that's why there is such a big picture of, not making enough breast milk or women stop breastfeeding early is because they just don't have the nutrition there to be able to produce enough. Similar sort of nutrients, your zinc, magnesium, omegas, etc., are very important for the mental health component postnatally as well. And recovery. So, I mean, if you've had a Caesar, you've got a massive wound. If you've had a vaginal birth, you've got also a massive amount of recovering to do. So some of the key nutrients for collagen recovery include vitamin C. You can take a good quality collagen. So the brand that you're looking for with collagen is Gelita. Lots of bone broths and healing soups and things like that postpartum are essential as well.
I love that you talk about the additional calories that you need in breastfeeding as well, and that culture that's happening at the moment with low milk supply for mothers who are wanting to breastfeed, because that happened to me. And it wasn't necessarily I was trying to lose weight after having my first baby, but I didn't set myself up properly postpartum. And every time I went to make myself a meal, baby was ready to breastfeed again. And so then it was cold and I wasn't eating till 2 hours later. And by that time I was already starving. And this cycle continued throughout my postpartum period, and my milk supply was basically non-existent. So it's just so important to prepare yourself for postpartum as well, to make sure that you are consuming enough calories and have a good nutrition postpartum to support your not only your healing, but if you're breastfeeding, then to be able to produce enough breast milk for your baby as well.
Absolutely. It's a huge undertaking, breastfeeding to produce enough milk. Some women naturally just do produce. I was a major underproducer as well, Ellen, so I feel your pain. It's so tough, so tough.
Yeah.
I'm sure you'd feel that you would just do anything. You would eat anything, you would drink anything, you would take all the potions. But there, luckily, and obviously for me, I'm a practitioner, but at that time, I couldn't think clearly. I was like, I don't know
Mm.
what herbs I need. I don't know what I need right now. So it was just eating as much as I could to try and produce enough.
Yeah, yeah. So, as a mother of two, how has your own personal experience shaped the care that you give in this maternity setting?
Being in practice 15 years, I've never really been much of a, we're taught when we become clinicians, don't be emotional. It's not good to show too much emotion or give too much empathy in it. You've got to be empathetic, but keep it professional. But since becoming a mother and working with women only now, I think that has become my biggest strength in my clinic. When I'm with a mum and I can be like, you know what, I know what you're going through, like that sleep deprivation and feeling like you're the only one in the whole world that's awake right now. I know what that feels like. And I think that has enhanced my care because before I've done fertility and IVF and pregnancy and all of that for years, but I've only really been a mum for the last 4 years. So I think I am much, much better equipped to say I understand and to help these mums in this space now.
Yeah, totally. It just brings a whole nother level of deeper understanding, I imagine, to
Absolutely.
your care. Yeah.
Yeah.
So,
Yeah.
what challenges have you encountered in advocating for mums in terms of integrating, holistic practices into mainstream maternal care? It's a very medicalized world that we live in.
The very medicalized world that we live in. Absolutely. And it really is dependent, again, it's very individualized on patients as well and their approach and their attitude. So a lot of women, I assume a lot of you, your listeners, Ellen, would be quite enlightened and would have a lot of awareness in this space. But some mums really have no idea. They go into motherhood with absolutely no idea. They take what their GPs and obstetricians say as gospel, and they take one example is a ferrograd C, which is a constipating iron supplement, and then they haven't had a bowel motion for 3 weeks by the time they end up in my clinic room, and they're just like, oh, the doctor said that was pretty normal for pregnancy. So it really is an education thing. To integrate, I think you have to come at the beast with the best tools you can. So you have to come at it with the research, you have to come at it with the evidence, and you have to be able to talk at the medical level. You have to be able to say, no, this patient needs an iron infusion. She can't get off the couch. She's 37 weeks pregnant. She has a 3-year-old to look after. We need to give this woman something. Look at her.
Yeah,
so,
yeah.
so just a realistic approach that talks to signs and symptoms is the way to integrate. And it is very challenging. I think that a lot of my friends have babies, they've all had these challenges as well, where without the knowledge to be able to speak up and advocate for themselves, they don't really have anything else to bring to the table and bring to their appointments as well. So I think evidence, science, but also the work that a lot of organizations are doing, such as Panda, etc., is a really big way to be able to find holistic areas in which naturopaths and acupuncturists and doulas, etc., can all contribute to maternal care in Australia.
Yeah, totally. So, just to wrap things up, I've loved this conversation, but I have a couple more for you. What
Mhm.
piece of advice do you wish every mother knew about health and wellness during the perinatal period?
My best friend actually said this to me, and I've never forgotten it. In the last 5 years, my best friend said to me, your baby's not a robot. Your baby does not, do you sleep the same amount and eat the same amount every day? And I was like, no, I don't. She's like, so why do you expect your baby to eat the same and sleep the same every day? I was like, yes. So eliminating that stress of your baby needing a schedule of food and sleep and why isn't my baby sleeping through the night and why isn't my, that is the best piece of advice I can give is that your baby is not a robot. It will do
Yeah,
different things every single day. If it skips a nap, nothing. Yes, might be a challenging afternoon, but it will be okay.
they are their
And
own person. And so are
oh,
you as a mother. Yeah.
absolutely, we don't do the same things every day. So why should our children have these strict, sleep schedules and nap routines? And yeah, that would be the advice that I think has helped me the most. And the thing I would always say to them, it is okay to feel crazy sometimes. Especially those first 6 weeks, that hormone shift that happens once you deliver a baby, what that does, your estrogen and progesterone, and how that actually affects your brain, you are absolutely allowed to feel a little bit out of sorts. And that is the norm. You're not supposed to have this whole, Mother Earth experience. It's okay to feel a bit fancy.
Yeah, I love that. Are there any upcoming projects or initiatives that you're excited about that aim to support mums in their fertility, pregnancy, and postpartum journey?
Yes, actually, I was talking about the perinatal, sorry, gut flora and anxiety and depression. There's actually some clinical trials on that running at the moment, so I'm really looking forward to seeing the results of those.
Oh, exciting.
And yeah, it's actually really, really amazing research, and I can't believe it's taken them this long to do. And I'm actually about to undertake some health practitioner training with Panda. So Panda, as we know, is perinatal anxiety depression for Australia. They actually, and this is for all health practitioners to undergo additional layers of training because perinatal anxiety and depression is not like everyday anxiety and depression. It's a whole other space.
Yeah. Oh, so important.
Yeah. And I
Yeah.
actually, in my experience of treating mums and talking to mums every day, I don't think there is a mum out there that has not experienced postnatal anxiety and depression. Every single mum has, but it's a spectrum. Some are on one end of the spectrum, others are on another end of the spectrum. So everyone has experienced it, just at a different level.
Yeah, totally. So, for listeners who want to learn more about the work that you do and want to get in touch for some individualized advice, how can they reach you?
Yeah, so Brisbane based, but we also do telehealth. Our practice is, as I said, the Ritual House in Bowen Hills. We have like spa and sauna here as well and kinesiology. So yeah, you can always book in for a consult. And I do telehealth Australia wide. I do some international telehealth as well. So wherever you're listening from, I can help you in some way, I'm sure.
Oh, beautiful. Well, I'll link everything in the show notes for the listeners who want to get in touch. And thank you
Yeah.
so much, Sunny, for coming on the podcast. I've loved this conversation.
Oh, thank you so much for having me, Alan. It was a pleasure.
Thank you for listening to this week's episode of the Mama Village podcast. Check out the show notes for a link to the Mama Village Instagram page where I upload pregnancy, birth, postpartum, and motherhood resources. Please let me know what you think of today's show and what you would like to hear from the podcast by leaving a rating and review. If you like the show, please subscribe and leave a review on your podcast platform. If you would like to share your positive pregnancy, birth, postpartum, and motherhood story, or if you have education in the space to share, please send me a direct message on Instagram or email the.mamavillage@outlook.com. For all my listeners out there, thank you for your continuing support, and I will speak to you all in next week's episode.